Definition: it is assisting in the introduction of a catheter into the bladder through the urethra for the relief of urinary retention or for emptying the bladder completely. Assessment: assess when client last voided to indicate likelihood of bladder fullness. Assess level of awareness of development stage. Assess the mobility and the physical limitations of the client. Assess client's age to determine catheter size to be used. Assess the patient's bladder for distension. Assess presence of pathological condition that may impair the passage of catheter from urethra into the bladder. Assess purpose of catheterization. Check physician's order for method of catheterization to be done. Assess if client is allergic to antiseptic tape or rubber. Assess need for perennial care before catheterization. Objectives are to relieve acute, chronic, and urinary retention, to promote urinary elimination, to obtain a sterile specimen, to obtain accurate measurement of bladder function, to provide continual urinary bladder drainage, for pre-operative and post-operative drainage, to measure the amount of residual urine after avoiding, to monitor the output of critically ill patient, to prevent skin breakdown and incontinent bedridden patient. General considerations are: follow good hand washing techniques. Do not allow the spigot on the drainage bag to touch a contaminated surface. Do not open the drainage system of connection points to obtain specimens or measure urine. Do not open the drainage system and connection points to specimen or measurement urine. If the drainage tubing becomes disconnected, do not touch the end of the catheter or tubing. Wipe the ends of the tube and with antiseptic solution before reconnecting. Prevent pooling of urine and reflux of urine into the bladder. Remove the catheter as soon as possible after conferring the physician. Types of catheterization are intermittent, straight, Foley indwelling catheterization. Types of catheter: straight catheter, Foley catheter, cord catheter. Indication of catheterization are spinal cord injury, neuromuscular degeneration, incompetent bladders, prostate enlargement, clients undergoing surgical repair of the urethra, critically ill or comatose patient, severe urinary retention, clients with skin rashes, ulcer, or wounds irritated by contact with urine, pre-operative or post-operative, prepartum and postpartum patient, urinary incontinence. Equipment for straight catheterizations are straight catheterization straight catheter, sterile gloves, bowl, sterile towel with hole, sterile gloves, antiseptic solutions, KY jelly, sterile forceps, flashlight, sterile specimen container, flushing tray, and bedpan. Equipment for indwelling catheterization are catheterization tray, sterile gauze, sterile bowl, sterile towel with hole, sterile gloves, flashlight, French catheter number 8 to 10, number 12 to 14, number 14 to 16, and number 16 to 18. Drainage bag, pre-filled syringe with a needle which contains distilled water. Sterile specimen container if necessary, flushing tray. Step 1. Obtain the treatment card from the nurse and check with doctor's order. Bring equipment to bedside table, check lighting source, identify the patient, explain the procedure to the patient, need for to keep knees positioned during procedure, describe pressure sensation that will be felt during catheter insertion. Patient will feel reassured if the procedure is explained and if is handled gently and considerately. Screen the patient to provide privacy, reduces client embarrassment and aids in relaxations during procedure. Place bed in high position and lower side rails on working side, promotes use of proper body mechanics, place patient in dorsal recumbent position, and if male, bring knees up and out, may need assistance to keep knees in the position. This position provides for good visualization of the urinary meatus and perineal structure. Drape the patient with top sheet to expose perineum and avoid unnecessary exposure of the body parts and maintain client's comfort. Provide perineal care if needed. Presence of microorganisms near your urethral meatus is reduced. Place tray between thighs facing foot of the bed. Adjust drop light. Permits accurate identification and good view of the uteral meatus. Place waste receptacle at an area near you. Wash hands for asepsis. Open sterile pack. Grasp its corner and open it with care, touching only underneath the sides and edges to provide the sterile field and prevent the transmission of microorganisms from table or work area to sterile supplies. Let doctor open the pack of sterile gloves to put on gloves. Allows doctor to handle sterile supplies without contamination. Observe sterile technique and offering pack of towel to maintain sterility. Place adequate amount of lubricant over the non-dominant hand after the doctor cleanses urinary. Allows easy insertion of catheter tip through urethral meatus. Pick Foley catheter. Remove outside pack, observing sterility, ensuring that the tip of the catheter will be offered for lubrication insertion. Instruct client to breathe through the mouth while doctor inserts catheter to the urinary meatus. Relaxation of external sphincter aids in insertion of catheter. Place distal end of catheter in a sterile bowl to measure urine volume or attach to drainage of as indicated. Collection of urine prevents soiling of the client's bed, linens, and allows accurate measurement of urinary. Collect urine specimen if needed. Fill sterile specimen container to desired level by holding end of catheter over the specimen bottle. Allows the sterile specimen to be obtained for culture analysis. After that, the doctor removes straight single-use catheter, slowly remove drapes. Discomfort to client is minimized. Position the patient for comfort. Put the bed in low position with side rails. Discard the equipment in the utility room. Wash hands thoroughly. Steps. Follow steps of straight catheterization from numbers 1 to 17. Offer 10 cc of syringe filled with distilled water to the doctor to inflate the inflation balloon. Attach end of the catheter to collecting tubes of drainage system unless already connected to the bag. Closed urine drainage is established dependent position of drainage bag promotes flow of urine away from the bladder. Tape catheter female client. Tape catheter to the inside of the thigh with strip of non-allergic tape. Follow for slack so that movement of thigh does not create tension on catheter. Male client, tape catheter to the top of his thigh, lower abdomen. Allow for some slack in catheter so that the movement does not create tension to the catheter. Anchoring of the catheter minimizes trauma to urethra and meatus during client's movement. Catheter positioned over the thigh prevents kinking. Non-allergic tape prevents skin breakdown. Anchoring catheter to the lower abdomen is thought to reduce pressure on urethra at junction of penis and scrotum, thus reducing possibility of tissue necrosis in this area. Be sure there are no obstructions of kinks in tubing. Places excess coil of tubing on bed and fasten it to bottom sheet with clip from drainage set or with a rubber band and safety pin. Patent tubing allows free drainage of urine by gravity and prevents backflow of urine into bladder. Assess client to a comfortable position. Client's comfort and security are maintained. Instruct client on ways to lie in bed with catheter, side lying facing drainage system with catheter and tubing drape overflow thigh, side lying facing away from system, catheter and tubing extended between legs. Urine should drain freely without obstruction. Placing catheter under extremities can result into obstruction of compress of tubing from client's weight. When client is on one side facing away from system, catheter should not be placed over upper thigh. This forces urine to drain uphill. Caution client against pulling on catheter reduces trauma to urethral meatus. Wash hands. Reduces spread of infection. Palpate bladder and ask if client remains uncomfortable. Determines if detention is relieved. Observe character and amount of urine in drainage. Determines if urine is flowing adequately. Record type and size of the catheter. Inserted amount of fluid used to inflate balloon. Characteristics urine. Amount of urine communicates pertinent information to all members healthcare team. Evaluation, residual urine measured, sterile urine specimen obtained, catheterization performed using sterile techniques, retention catheter inserted without difficulty, bladder emptied when patient is unable to void.